Hey guys, and we're live. Hopefully this stream will go well. I'm having a little bit of connection issues with the internet, but everything seems to be okay at the moment. Today's live stream, the topic will be abortion, my thoughts on it, and I'd like to know your thoughts when people start arriving. We're going to do this by looking at an actual debate between Michael Knowles and a pro-choice activist, and use that debate as a way of opening up a discussion. Hey, G Legend, how are you, man? We're going to be talking about abortion. We're going to be looking at a debate, as I just said before, just as you were arriving. I'm going to wait just a little bit more. Maybe hopefully, 4 or 5 people at least will be here. What are your thoughts, G Legend, on abortion? We are going to present screen. Maybe we can present it that way. All right, we got 4 people, so we could probably start shortly. Oh, Michael Knowles. They changed the interface a little bit. Geez, I don't really like how they're stop sharing view tab. Okay, just give me a second, guys. This is odd. It's a completely different format, in my opinion. Okay, I think I got it. Sorry, I'm just playing around a little bit. We're trying to figure this out. Share screen. Sorry, guys, for the dead air time. Pregnancy, fetal development week by week. Yeah, it's just set up a little differently, and it kind of is throwing me off a little bit. All right. So I just want to start out by looking at the fetal development, the week by week. So that'll give us an idea when we look at abortion, how much development has occurred. All right. Share screen. Okay, so we're going to look here, abortion after 26 weeks. That is not the one that I want. Fetal development. Very good. I'm just going to log on to make sure that you guys are seeing, or I've set it up so that you guys can actually see, since this is a new interface and it's kind of screwing me up. Seeing or okay, good. All right. That's okay. We're going to start, and I am going to present screen bigger. Screen share. Perfect. So we're looking at fetal development over here. Please put in the chat if ever you're not seeing what I am trying to present. This is a presentation you should be seeing Cleveland Clinic at the moment. We're looking at fetal development, and they go through week per week what's going on here. So let's look at the first trimester at the moment. Set it up so that you So the first trimester will span from conception to 12 weeks. This is generally the first 3 months of pregnancy. During this trimester, the fertilized egg will change from a small grouping of cells. And notice this is always what they call a baby. They always say it's just a clump of cells. While this may be true for the first week or two, for example, or maybe even 3, I don't know. We're going to look at the development, but they like to say it's just a clump of cells, and they'll say this right up to 15 weeks. And I'll show you that there are abortions that are done, late-term abortions in certain areas, past 26 weeks. Mind you, 20 years ago when I worked in neonatal intensive care units, 25 weeks was the youngest that we were able to save. Now we have a 20-week-old baby that survived a premature birth. So if you put that into your mind and understand that 26 weeks, past 26 weeks, we can see that they are doing abortions after 26 weeks. So week 1 through 4, although it's strange, the first 2 weeks of pregnancy are a getting ready period. Your body slowly releases more hormones, and your uterus prepares for a potential pregnancy. At the end of the 2nd week, your ovary releases an egg. If the sperm meets an egg just after ovulation, the process to pregnancy continues. The fertilization occurs during the 3rd week. A sperm and egg join together. The tiny bundle of cells turns into blastocyte and implants into the uterine lining. The beginning of what will become the placenta forms. Just want to check. Okay. Fertilization occurs. Okay, so at week 4, still a tiny bundle of cells, the beginning of which will become the placenta that forms. A watertight sac forms around the blastocyte. This is the amniotic sac, and it provides a cushioning to a fetus during pregnancy. The 2nd month of pregnancy is when most people realize they're pregnant. Pregnancy hormones go into overdrive, and by about the 5th week, an at-home pregnancy test will show as positive. This is when many people begin to feel symptoms of pregnancies. By the way, just a side note, I was supposed to work today. I made a mistake, and I took some medication twice. It made me super dizzy by the time I got to the hospital. So I'm still feeling like a bit spaced out, and maybe I shouldn't have done a live stream. I still feel a little bit out of whack. Sorry about that. Yeah, I took my medication. I must have taken my medication and then started to get ready, and then took it a second time. And then it takes an hour sometimes for the medication to hit. So by the time I arrived at work and got out, I was like completely dizzy. So yeah, everything was normal because obviously I work at the hospital. So I just went to the emergency room. Anyways, that's just a side note. The second month of pregnancy, we've already done that. So by week 5, the neural tube, the brain, spinal cord, other neural tissue of the central nervous system forms. The tiny heart tube will beat at 110 times a minute by the end of the 5th week. Week 6, we have tiny buds that become arms and legs, also develop. Blood cells are taking shape, and circulation will begin. Structures that'll become the ears, eyes, and mouth take form. By 7, the bones begin replacing soft cartilage, and genitals begin to form, and the embryo's head is large in proportion to the rest of its body. Some people think the embryo resembles a small tadpole or seahorse due to its prominent tail, which becomes legs, and its large head. By week 8, all the major organs and body systems are developing. The fetus has web-like hands and feet. Eyes become visible, and the ears begin to form. The umbilical cord is fully developed and helps to transport oxygen and blood to the embryo. After week 8, let's just jump to over here, right here. The third month of pregnancy. So week 9, the beginning of teeth and taste buds are forming. Its muscles are forming, and his body takes a shape. It's shaped more of a human appearance, but its head is still 50% of its length. Week 10, the arms, hands, feet, fingers, toes are fully formed. No more webbed fingers. Fingernails and toes are beginning to develop, and external ears form. The external genitals begin to form, but it's too soon to see them on the ultrasound. Week 11, the fetus is starting to explore a bit by doing things like opening and closing its fists and mouth. It's, sorry, I was just checking. Everything is good. Okay, sorry, I was just reading. All right, so that's week 12. As we get to, don't forget, a lot of the abortions are done at 15 weeks, but we do know that there are some places where late term abortions are legal. So the vocal cords form, and the fetus's large head begins to grow proportionate to its body. The skin starts to thicken, and fine hair begins to grow. It can start bringing its fingers to its mouth and turn its head. External genitals are fully developed, and fingerprints begin to form. Some organs by week 15, like your intestines, ears, are moving to their permanent location. The fetus still uses amniotic fluid to practice breathing, but its lungs are beginning to develop. The fetus begins to make more purposeful movements like sucking its thumb or smiling. The fetus has lips and ears and are developed enough that it can hear you talk. Even though its eyes are closed, the fetus can react to light by turning away from it. So you can see that around week 15 and 16, where abortions can occur legally everywhere, where, in the States initially before that recent overturning, it was a federal law that abortion was legal in all the states. In Canada, it's the same thing as well. Now there's a recent thing where they're putting it to the states each state to decide, and that's where they are at now. So now there's some states that very often Republican states that do not support abortion. So you're not allowed to open abortion or to practice abortion in that state. And then Democrats very often, they're pro-choice, killing babies. So they can vote in those states and have abortions. 17, the fetus still has thin skin, but will start to put on fat. The skin is covered with a whitish coating called vernix. The fetus at 18 is covered in lanugo, a peach fuzz-like hair. The fetus may have a sleep-wake cycle, and loud noises may wake the fetus if it's asleep. So if it's already around this area over here, even at 15 and 16, reacting to light, reacting to sound, just realize that most abortions are a dilation of the cervix entering into the uterus through the dilated cervix, and with tongs ripping appendages off of the fetus, off of the baby, just legs, then arms. The brain is crushed, ripped out the head, and then the torso. Then there's a suctioning that occurs, and then a scraping that occurs. That's most of the abortions are ripping the limbs off of these babies at week 15, when we know that the baby's already sucking its thumb, it's smiling, it's making more purposeful movements and things like that. Over here, reacting to light already. Okay. So week 19, we have the fetus getting stronger, begins to feel. They begin to feel kicks, punches, movements, even hiccups. The nails grow towards the end of its fingers at week 20. The area of the brain responsible for 5 senses begins to develop, and we continue. Over here, just want to see. So if born prematurely, the fetus may survive after 23 weeks. But as you realize, we also have abortions, like the clinic that I just showed, the abortions past 28 weeks. This is when the baby 100% is feeling everything, because we know that at 23 week, a baby can survive through being born intensive care unit, a lot of medical interventions, but at least the baby is safe and sound. Just looking at the comments before we start the video with Michael Knowles and with Bront Remsick. So Michael Knowles is a conservative, a Catholic Christian, and he is the pro-life choice, and this lady is the pro-choice, or the pro-killing the baby side. So we have G Legend that's saying hello. Also Margaret Leach. Margaret says abortion is used by some as birth control. It's a life. Safe sex, get married, or keep your pants on. Yeah, exactly. Hi, just passed to push on a thumbs up button. Have to go to work. Good stream, Jason. Thanks, Elias. Oh no, Jason, on your phone, put info and time in your clock setting. Oh yeah, for the pills. Yeah, well, I mean, I'm assuming if everything's normal and it started, I got dizzy and vertigo, and then it started getting better and better and wore off after 5 hours. I'm pretty sure it's when the medication hit and the peak, and then the medication's going down. I'm feeling better. It's quite embarrassing. But yeah, maybe I mean, I usually get up and, I put the medications in my mouth. I don't know how I could have done it twice, but it's very likely that's the issue. I just want to make sure. Stop sharing. So we can look at this in more detail, but here's an example of the DuPont Clinic over here that supports abortion after 26 weeks. It'll go into details as Dilapan is a sterile synthetic polymer similar to laminaria. We will give you medication beforehand, and we take several additional steps to make sure you're comfortable. So we could look into more detail, and I mean, it's not that long, but let's see. If you are 26 weeks or later in your pregnancy, you can still we can still see you regardless of your medical history, blah 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 blah. 3-day abortion procedure is called the DuPont induction evacuation. The first day is a preoperative appointment, which will involve ultrasound, etc. Blah 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 blah. When you return on the second day, your provider will perform a brief pelvic examination to place Dilapan to help your cervix open slowly overnight. Then you return on the third day. You will receive IV medication to make you feel comfortable and relaxed. Once you are comfortable and your cervix is dilated, the physician will complete the abortion procedure. While the procedure itself is short, the dilatation process can take anywhere from 1 to several hours. So it's something with Dilapan that you guys can look up. It doesn't go into too much detail, probably because it's horrible. All right, let's finally get to Michael Knowles and the debate.
Kindandcurious.com. Okay, I consider myself kind. I am extremely curious. You have done us the great honor of coming out here and gone through all the hassle that it takes to get to Tennessee. So you are staunchly in favor of abortion. I am your captive audience. If you had to give me the elevator pitch, what would it be?
Absolutely. So what I would really like to start this conversation off with and make very clear from the start for both you and your viewers is I am not saying that you are wrong for being uncomfortable with abortion. I'm not saying that you are wrong for not agreeing with it, but your opinion applies to your body and your life alone. We are not sitting here having a discussion about our personal disagreements. I am here to educate you and your viewers on the guidelines of proper medical.
I'm glad this medical student is using her medical background as a student to appeal to authority. I'm glad that she's here to educate us. I'm glad that she understands that Michael Knowles, as well as me, we're uncomfortable with murdering children or babies because we're ignorant. We just don't understand. But I'm glad that she's going to educate us.
Practice that have been established by our country's leading medical experts, and they have stated publicly and unequivocally that abortion access is essential to comprehensive evidence-based healthcare.
Okay, we do not need a medical background or even high school to make a moral and ethical position, to adopt a position morally and ethically on abortion. It's funny because the secular people will say that there's no objective morality, that it's relative, that it's subjective, and that often cultures will decide on what is moral. So now we're trying to use that secular approach of morality by saying, well, then as a culture, we need to discuss this openly. And then after, they're turning around and saying, shut up, you're not an expert, and you will listen to the experts because they understand ethics and morality better than you. And this is something that we're seeing more and more. Trust the experts. This happened during the pandemic. This happened with all the guidelines, the lockdowns, the way the medication was distributed, right? All of these things. Not to mention that there are medical experts that were not given a platform to share their expertise. So I love expertise. The word expertise, when that comes up, it means shut up, trust the experts. You know, you don't have a right because you're just a peasant.
And we both want to protect life. And what remains true is protecting innocent life never involves restricting access to healthcare.
So
Just to make it clear, okay, healthcare, abortion is not healthcare. Okay, it's not a procedure that you must do to improve or prevent the decline of a person's health. It's not health care. It's a medical procedure that is used to end the life of a baby. And this can occur often at 15 weeks, up to 15 weeks, but it does occur much later in certain areas.
two questions I have from that. You mentioned that all of the genius medical people agree in our country that we need to have abortion. Now, surely all of the genius medical people have agreed on all sorts of practices throughout history, even in the not so distant past, that are quite terrible for people. One good example would be lobotomies. There was a scientific consensus in the country that when women are behaving a little eccentric, we should go in and scramble up their brains. And that is ghastly and a violation of basic rights.
Mm-hmm.
But this was a medical consensus. So surely you're not telling me that just because a bunch of fancy people in lab coats think something about a matter of bioethics, that therefore it's the gospel truth.
Well, a big part of the prior, travesties of medicine is there was not consent from patients, and there wasn't proper informed consent from patients. Where when it comes to abortion, you continuously say that I am pro-abortion, when really I am pro-abortion access. And abortion access and the discussion of having an abortion should be between the patient and the medical provider, and that is it.
No, look, a doctor cannot do whatever he wants to another patient. There, you know what I mean? So this idea of like, well, the doctor and the patient can do a immoral act, and that should be protected. They have the right. Okay, listen, this is a child. So first of all, there's all sorts of birth control. There's condoms. There's the pill. A variety of sponges. All sorts of contraceptive. Also, I guess following your cycle to know where you're in. There's danger of you getting pregnant and stuff like that. I don't understand the whole cycle, but I know that women can follow their cycle as well. There's also, look, I understand that if you look at, marriage, right? Oh, you shouldn't have sex before marriage. I understand it's a secular society now, but it is still a sacred act, right? This is why making love is a spiritual and sacred and religious act. It's a beautiful thing. It's a wonderful thing. However, nowadays it's just open sex, right? It's like one night stands going on apps, finding people and stuff like that. Just, consent, when they say like consent for sex, nothing, between two adults, there's no problem with that at all. The problem is that, you know what, you want to do that, fine, okay, but do realize every time a woman spreads her legs, okay, to do that act, this is a choice that the woman has made. It's a choice that she has made, and there are certain consequences that go along with that choice of performing that action. And those consequences, if it occurs, one of them being the conception of a life and a future human baby, right? So just give me a second. Sorry.
And
Let's just continue. I just forgot, lost my train of thought.
And the entire concept and the entire point is that the pregnant person gets to consent to continue.
Pregnant person, a woman, that's another way. A pregnant woman
With their pregnancy and must consent to the use of their body, because they are the one that understands their body and their life and their finances and everything that makes.
Yeah, sorry. Yeah, so the consequences can be a birth, okay, the birth of a new life. Now, don't go and start saying that the mother now requires health care to terminate the pregnancy because she's going to be sick. You see, when a mother ends up becoming pregnant and during the pregnancy, there is a danger to the mother, a life-threatening event, the pregnancy must be terminated. That's not considered an abortion. This is to save the mother's life. It's not the same. And a lot of the people were saying about that, oh yeah, well, this is going to, mothers are going to die because of this and stuff like that. There's also the idea that, well, if abortion is not offered, women will do dangerous things and try and abort their baby anyways, and that can cause serious harm. So listen, if you open your legs to perform a sacred act and you get the consequences that you knew could happen, which is a baby, then then you should assume the consequences, not use a method that is called abortion, and murder your baby. That's why it used to be sex after marriage. So do what you want, have sex, but the moral thing to do is to assume responsibility and to assume the responsibility and the consequences of that action. Not going and saying, it's not convenient for me, I don't want a baby, then I'm allowed to kill it.
Accept the complexities of human life. They're the only ones who are able to decide and understand what is best for them with the guidance of, proper modern medical practices. And it is true that our world and our country's leading medical minds have, like I said, unequivocally stated that abortion access is essential to comprehensive, evidence-based healthcare. And your opinion can remain your opinion, but it does not get to override the opinion of people who train their entire lives to provide healthcare to people.
Well, so on the matter of consent.
Okay, look, physicians are just as, they're human. So they are not the epitome of ethics and morality. Okay, they don't have a unique view of certain procedures that are done when it comes to why details about a procedure. No, okay, if you're not a physician, but the morality of certain actions taken in the medical field for outside for the culture to not be able to comment on that to be told you're not an expert, shut up, you have no credentials. There is a religion that has sprung up from science, from sound science to scientism, where now the population is shushed and told, follow the narrative and listen to the experts. Who are you to speak about things that you know nothing about, kind of thing?
And obviously, the clear rebuttal to that would be that abortion involves not 2 people, but 3 people, one of whom is the unborn baby. Now, I imagine you would have issues with that description, so we can get to that in a moment. The first thing you said, though, is that I'm entitled to my opinion, but I'm only entitled to my opinion as it pertains to my own body, and I'm not entitled to an opinion about what you do with.
Yeah, exactly. It's like, oh, you can comment and have opinions on yourself, but not on other people. So let's say women getting raped. That has nothing to do with me. I'm not a woman, and this is not something that you know what I mean. So I can't comment on the ethics or the morality of this because, well, technically men can get raped, but I think you get the point. There are injustices, there are immoral things, there are unethical things, there are disgusting things that all of culture and society have the right to comment on.
Your own body. But do you really believe that? Do you really believe that people can only have opinions about things that pertain to their physical selves? I can't have an opinion about, I don't know, a sunset, or I don't know how automobiles are made, or I don't know, drug use or anything like that. I can't have an opinion about politics, how our government should be run, or how our political community ought to behave. I can only have opinions about myself.
No, I think you misunderstand me. You can have your opinion.
You can have your opinion, but you can shut the hell up and not share it. And your opinion is based on ignorance because you're not a expert. But this med student is an expert.
About anything and anyone that you'd like, but that opinion cannot restrict someone's access to healthcare. You can disagree.
It's not healthcare. It's the killing of a human baby in its developmental stage.
With someone's choice to get an abortion, but just because you disagree with it doesn't mean that your opinion should override the opinion of their medical experts.
Can my opinion be put into effect to restrict someone's access to drugs like heroin?
Well, in what way?
Well, we have self-government in the United States, at least nominally. And so if I think that heroin is really bad, and I think we ought to have laws against its use, then I can lobby my elected representatives and they can pass a law.
But seriously, during the pandemic, my body, my choice didn't apply anymore. At least in my country, there was an extreme amount of coercion and intimidation, and basically threats of losing your job or being suspended without pay and things like that. So it's funny that when it comes to killing your baby, my body, my choice. When it comes to not wanting a certain medication and still being, don't want that, but would like to have the right to leave my home and go work and get money and pay for my mortgage, rent, heating, stuff like that. Like that's what I want. And those rights were pretty much not directly, but indirectly. It's like, oh, what do you mean we're not forcing you? Did anybody come and just force a job? No, you basically said no problem, but you can't work and you're going to lose everything. But we're not forcing you. You can still make a choice not to get it. We love you. Bye-bye.
As they have against heroin, and then you are not allowed to use heroin, even though that.
Look. In the cities, some of the cities, some of the states are riddled with drug addicts and with drugs in the street. And communities and businesses just leave those communities. People are suffering because other people want the right to inject or to consume drugs. It's like, hey, my body, my choice. You can have an opinion on it, but I'm allowed to decide what I will do with my body. I have body autonomy, and I wish to inject these drugs. However, by doing this, I end up, I do my part, because it's not just one person, to cause a epidemic of drug addiction that completely ruins and increases violence, increases crime, increases all sorts of criminal activity. But it's my body and my choice. Of course not. We don't allow that. We don't allow people complete bodily autonomy to do all sorts of things to themselves.
Affects only your own body. I have now expressed my opinion about heroin in such a way that it restricts what you can do with your own body. Are you saying that that is not acceptable?
So actually, with laws regarding drugs, it is illegal to buy and sell drugs, but it's not actually illegal to do drugs, because you can't tell
Depends
me.
on the jurisdiction. But yeah.
True.
To buying, selling, illegal. Now it's becoming decriminalized, but it used to be, when you got caught with drugs on you, it was criminal. You broke the law. Now all of a sudden, like, it's like, oh well, let's decriminalize, let's legalize marijuana again. This is just another step in dismantling the West. The idea of the World Economic Forum, these globalists and these elite overlords that want to basically centralize all the power towards them. So this that's just another tactic that is basically being used to accomplish those means and that end.
But you cannot tell me what I can or cannot do with my body. Again, you can totally and rightfully so disagree with someone's choice to do drugs, but that doesn't mean that we shouldn't, as healthcare providers, ensure that say, drug user is able to make informed choices about their body. Are you familiar with like clean needle programs?
I am. Yeah.
Correct. And so clean needle programs, they reduce disease transmission. And so even though someone is going to choose to do drugs, it is the responsibility of medical experts and healthcare providers to ensure that we cannot,
I am completely for clean needle programs. Like, no problem with that at all. I just don't see how that has anything to do with opening your legs, having sex, getting pregnant, and then killing the baby. I don't see how these two connect.
We cannot change someone's choices and behavioral patterns, but we can ensure that we provide them resources and able to ensure that their decisions and
because getting pregnant there and going in your room or something with a coat hanger and trying to abort your own baby, and then seriously hurting yourself or dying from that stupid move. That's what they're trying to say. Well, if you do not offer women this, they're going to do dangerous, medical procedures done in back alleys kind of thing by non-medical people. Again, that is a choice. You chose to open your legs. You have the consequences of your choices, right? You're pregnant. And then after, you also have a decision to make. Do I keep the baby? Do I keep it, send it for adoption after birth, or do I kill it? For every baby born, there's 12 couples waiting to adopt that baby. So there's plenty of people that want to adopt. So since you performed a sacred act, and the consequence of that was the creation of new life, the least that you can do is not kill your baby, and you can easily give birth to it, because that's the consequences. Assume that responsibility, and then make the decision at that point, financially, or I just don't want the baby. Then you can give it, and then there's 12 people for every baby. There's 12 people waiting for every single baby being born to adopt them.
The impact of their decisions is minimized in whatever way that we can.
Bronte, putting aside for a moment the efficacy of clean needle programs, which I think is dubious, but that might be a discussion for another day. I think you're evading the question a little bit here, because you're suggesting that drug use is not criminal in all cases, which is not the case. There are places where drug use is where the use of the drugs itself is criminal. But even so, let's take that, let's accept your premise. Nevertheless, purchasing the drugs would be illegal. Now, this is something you do with your own body, with your own money. This is, it's the very same issue, just removed one step. So is it all right for me to express my opinion about illicit drug use, to restrict you from doing something that you want to do, be that shooting the heroin, purchasing the heroin, putting the heroin in a syringe, whatever you want to say? Clearly, I am restricting your bodily autonomy here, and that has been done throughout civilization. That remains on the books in the United States. So are you saying that drug laws are basically some sort of travesty?
No, of course not, because it's a matter of public health. Now, when we talk about pregnancy and abortion, essentially what causes pregnancy is sex, correct? And we cannot outlaw sex unless that's something that you are.
Yeah, we can't outlaw sex, but people should assume responsibility for having sex, understanding that you're using sex, maybe outside of marriage, maybe you're not a couple, and you're doing that. It's like, no, I want to have sex. I'm not religious. There's no rules. Leave me alone. This is natural. Fine, whatever. You could have used a condom. You could have had the some kind of contraceptive, whatever. You could still maybe get pregnant by using that. Condom breaks, pill, just, it's not 100%, whatever. But you decided to spread your legs to perform that action, and you should at least have the decency to assume responsibility. And what the heck is up with late-term abortions? Like, seriously? Like, you have to wait over 26 weeks before you decide to murder the child? It's a long time.
Trying to bring forth. And so when it comes to, laws limiting someone's ability to have bodily autonomy, or, limit someone's ability to behave in a certain way, this is sex and pregnancy and abortion is a very unique circumstance. And sure, we can talk all day about some convoluted,
It is a very, very unique situation. Having within a woman, okay, the ability to create another human being is a very special condition. And what you're going to do, and the rest of the pro-choice are going to do, is to basically say that this is basically a parasite. This is tissue. This is something that the mother, it's using the mother's body without the mother's consent. So therefore, because there's no consent, the mother can kill the baby. But the mother always consents, because knowing what can happen when you spread your legs, in my opinion, spreading your legs, doing the act, having sex and spreading your legs, okay, is you consenting to the possible consequence which is a creation, which is creation of life.
drug analogy. But at the end of the
I think it's
day,
convoluted.
yeah,
It's pretty
well, I know
straightforward.
that's your opinion, but
Yeah.
we cannot outlaw sex. And sex happens for numerous reasons, and pregnancy can be accidental and unwanted. And so trying to compare it to illegalizing drug use, it's not completely analogous to illegalizing and banning abortion, because
Yeah.
sex and drug use are two
Apples
very
to
different things, and they happen for two very different reasons.
Right. I suppose I'm just discussing the principle that you described earlier, which is that I don't have the right to an opinion that affects what you do with your own body. But even leaving that aside, you say that we can't make sex illegal. I don't think anybody wants to make sex illegal. But historically, all sorts of sex has been illegal, and all sorts of sex remains illegal today. There are certain sexual behaviors, even in our more decadent and inclusive age, that are illegal. Obviously, sex with children or sex with animals, things like that. Historically, sex outside of marriage has been illegal in many places. Homosexual sexual activities have been illegal in many places. So we've had laws in the United States and continue to have laws that regulate sex. All of that, though, I wonder, so historically, those are the facts. And doesn't that seem to be a little bit beside the point when it comes to abortion? Because now we're saying, no, that, consenting adults above the age of 18, they can have all the sex they want. But if you do have sex and you do get pregnant, well, you don't have the right to kill the baby.
Great.
Well, when you talk about things like, having sex with children or animals being illegal, that's because they can't properly consent to have sex. Where when we're talking about consent or sex with,
So the baby can't properly consent to the abortion either.
consensual sex between adults, that happens for multiple reasons. People have sex for social reasons, social connection, psychological reasons, not just for the.
Don't forget the Christian rule of you have to wait till you get married to have sex, right? Don't forget that this is way before the pill. This is way, way before, medical interventions like abortions were safely performed. This was way before that. Therefore, imagine if women were having the kind of sex, just this liberal, lots of sex, unprotected sex. Obviously, it would be unprotected. They didn't have condoms and the pill and stuff like that. So you could imagine somebody sleeping with guys often on the weekends and stuff like that, getting pregnant one after another. The mother not having a husband. Back then, the men were the ones that went out to work. Women tended to stay around the house and stuff like that. So with that, if she's having sex with men, but it is not in a stable, committed relationship, it's not just about consent. It's also about a committed relationship. That's what they used to do. It was beneficial. Now women have the pill. There's all sorts of contraceptive that allows the women to have so much more sex and not worry about the consequences. It's really the pill and contraceptives and condoms and things like that that really liberated women to have, like, let's have sex, and sex is empowerment, and sex before marriage and all of that.
The reason of procreation. And so sure, pregnancy can happen accidentally and unwanted, but consent must be enthusiastic and ongoing. And so when we talk,
What if it's only tepid consent? Sort of, well, I'll do it, but I'm not.
Vegan Dawn. Okay, let's ask the question, because I see a vegan here, and vegans are all pro-choice. They are often they're atheistic. So I'm sure Vegan Dawn is going to have a lot of interesting things to say. All right. Oh no, Jason, blah, 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 blah. Margaret, G Legend says to Margaret Leach, basically, we are in terms advanced creatures like a man of war. Okay. Not sure if they're quoting that. What about the consent of the defenseless baby? Killing a pregnant woman and the baby dies is still double homicide. I agree. think a case was in court, double homicide. It is death care. Yes, exactly. Margaret says the aborted baby could have been the next leader, Hawkins, Einstein. It comes down to good rearing of your children. She changed the topic. She has to be from California. So Vegan Dawn says, if that woman you talk about having fun actions isn't clever enough to not get pregnant, do you think she is parental material? Sounds more like the baby is a penalty. Is that fair to the baby? If that woman you talk about having fun action isn't clever enough to not get pregnant, okay, understood. Do you think that she is parental material? Sounds like, okay, yeah, I understand, I think. So this woman that got pregnant, she's a human being, and she is made in the image of God, and therefore morality applies to that person. And that person that gets pregnant from free sex, just in a non-committed relationship, or maybe in a committed relationship, just very selfish, and it's like, oh, it's going to affect me in a negative way. Yeah, I had sex over there, but I'm going to kill it. Well, unfortunately, murdering the baby because you think that baby is going to have a hard life. There's many children that have hard lives that become amazing people that are a blessing to society and stuff like that. A lot of times, hard lives can basically make you evolve as a human being. So I think that, yeah, not ideal. The mother, maybe not the best mother, but she got pregnant, and you implying that it's much better to just kill the child because the mother's probably going to be a crappy mother. That is a conclusion that comes from a disbelief in God, a godless mindset that can, because you believe that morality is subjective and that it's relative, you have come to a conclusion that it is better for the baby to snuff it out and to kill it than to allow it to live, because you can tell the future that baby's going to have a horrible life. Is she going to talk about abortion survivors? That's what Margaret asked. While being aborted, the baby is in agony and screams. The vocal cords are not fully developed to hear it. What about the consent of the defenseless baby? Exactly. Killing a pregnant woman and the baby dies is still double homicide. Think a case was in court, double homicide. And don't forget, like, that is why we have child protection agencies, to keep an eye on children, to put them in foster care if they are in a dangerous or abusive situation. So we have a social network as well to keep our eyes on crappy parents. Believe me. The aborted baby could have been the next leader. It comes down to, the good child rearing. Is the adoption fair to the child? Yes, the adoption is fair to the child, because there are parents that are adopting a child because they want to raise a child. So it is fair. There's also children that are born to crappy parents that wanted to give birth. So this idea that it's not fair to the child because the mother doesn't want it, and to force the mother to give birth, and then the mother doesn't want the child, so is a crappy mother. No, you don't want the child, you don't have to get it. You can send it for adoption. If you think vegan Dawn, that you're so backwards, okay, which I mean makes sense. You're vegan. Your logic and your morality is completely reversed to the point of saying that you're killing the baby, that you want the baby to die because that's in the best interest of the child, because you know for a fact that this child's life will be nothing but suffering. So all babies that are going to be aborted are, it's more loving. So look, the same thing applies. Unfortunately, there's parents that don't abort their babies and are crappy parents, and those parents as well are made in the image of God, and that for that reason they have a moral law that they are accountable to. I had 4 miscarriages. I was devastated. What is wrong with me? All I needed was a pinprick of my husband's blood, A and B. I'm blessed to have 2 lost daughter. Oh my God, to cancer. Son is my joy. Yes, agrees. She is an entitled person. Most abortion survivors say they are happy to be alive. As a parent, I would take the baby as my own. My daughter would do homeschooling till birth. I mean, you're talking to somebody who is raising a granddaughter. That was unexpected, but I'm Christian. I believe in God. I believe in God's will. As a Christian, I am told to take care of orphans and widows. Jesus, when he said, "Let the children come to me," that rang true. And there's also the parable of the sheeps and goats. And God, Jesus says a parable and says, when I was in prison, you visited me. When I was thirsty, you gave me water. When I was sick, you came to the hospital, kind of thing. People are like, when did we do this for you? And he says, what you've done to the least of these people, these little ones, you've done to me. So again, when it came to possibly long-term taking care of my granddaughter, or possibly just, kinship kind of fostering, it's a little bit unclear. It all depends on many factors. But the first thing that came was the worldly response of, I'm 43, Michelle's 45. We can't raise a child for another 20 years. I'm going to be 60 some. You're sick. What if it gets worse? But then after there was the reflection, the praying, and the understanding, using the Bible, and then the Bible kind of giving me the answer. Oh, it's like Jesus said, if this cup can pass my mouth, if I don't really have to get crucified, then, I'd really appreciate that, God. But Jesus says, but if it is your will, your will, not mine. So that's what I said to God when I was praying. I was like, you know what? I'm a Christian. My life isn't about my will. It's about your will. It's a blessing to be able to serve and to do this. And I said, what am I worrying about? God will bless me with so much love, knowledge, and wisdom so that it will go through me and towards my granddaughter. We're going to homeschool. We're going to, feed our granddaughter a diet like Weston A. Price, so that she gets all the nutrients. I know what to feed her. I know what to avoid. I know that it's important to get her to Jesus younger, because when you do it straight at the start, the child will accept it. But as the child ages, especially teens, especially adults, as you age through older and older, it's harder and harder for you to come to Christ. there's more, problems. There's more mental barriers and things like that. So the Bible does say if you raise your child in the Word of God, they will not depart from it when they're older. Let's see over here. The baby can't consent being born, destroying the woman's life, being adopted, maybe hating life, giving up to be anti-natalists, growing up to be anti-natalists. Okay, so you're making assumptions. You're like, no, it's completely fine. Like, I think it's more loving and moral to kill the life of the child because the mother opened up her legs and had sex and now was aware of the possible consequences. She is an adult that should assume the consequences of her actions. And you're saying, like, you're guaranteeing that this person, their life is so worthless that it's better off killing them. That's how worthless and the suffering and you don't know that, dude. You have no way of saying that. Look, what about babies that are born with severe genetic anomalies, serious birth defects, serious genetic defects? Why don't we just, I don't remember being a baby. I don't remember being born that day. I don't remember the first few weeks, even the first few months, right? So, maybe you can, kill these children when they're already born, but we'll do it quick, right? Maybe technically a late-term abortion, maybe the head can just come out, you slice the carotid and wait till it bleeds out to pull it out. Something along those lines. This is what a godless mindset gets you. This is what happens when morality is relative, is subjective. This is what happens when you leave a Christian worldview, or at least a theistic worldview, into a secular worldview. Morality just becomes basically convenience. Basically, that's what abortion is. It's really not convenient. That's why they call it Planned Parenthood. It's like, well, we'll kill your baby if you didn't plan to have it, and that's a way of planning parenthood. We'll kill your babies until you're ready to keep one of them eventually, right? Okay, makes total sense.
Yeah, I mean, that's a really big problem in our society right now. And, that's something that people will take, the small, people will push people to say yes. And that's why we say sex should be enthusiastic and ongoing. Because if you are trying to have sex with someone who's not enthusiastic about it, then maybe you should second guess your choices.
But isn't that a bit, I agree with you entirely, but isn't that a bit sex negative of you to say that there is a certain way that one should engage in consensual sex? I mean,
no,
you don't think so?
No, because enthusiasm is expressed, differently between people. It doesn't mean that you have to be jumping up and down. I just mean that the person who's consenting is consenting, very clearly and enthusiastically in their own way, and not being pressured into saying yes, not being timid about saying yes. You are ensuring that they are saying yes, out of their own validity. And when we talk, I want to compare like sex with pregnancy, right? Because we're talking about consent. So you understand that sex can be a fun and beautiful thing with, people do for lots of different reasons, but it's only fun and beautiful when it's consensual. And when sex is not consensual, it can be traumatic and devastating for people.
Yeah. Non-consensual sex is called rape. By the way, because I'm a man and stuff, am I allowed to even have an opinion on non-consensual sex?
The same thing for pregnancy. When pregnancy is consensual and pregnancy is wanted, it can be a beautiful thing. But when pregnancy is unwanted and non-consensual, then it can be a very traumatic.
I hold the position that once you open your legs to have intercourse, you have consented to the possible chance that you will become pregnant, and you should assume the responsibility of going through that pregnancy, giving birth, and from there you have the right to say, I do not want this child. I cannot do it financially, nor is my heart into it. No problem. We can continue to develop the foster care system, the adoption care system. And obviously, if we have all of those babies that are no longer being aborted, we can easily use these social programs and fine tune them and enlarge them. And there is many people that want to take care of young babies. Around age 1 to 3 years old is the highest adoptions. It is very true that a low percentage of teenagers get adopted. It's true that once you pass 3 years of age, people still adopt children, but it's a lot less. But when we're talking about babies, there's about 12 people waiting for each baby. So it is very moral, in my opinion, right down to rape. If I got raped, okay, I would not kill the baby. Why would I kill the baby for the sins of the father? Completely normal that perhaps you don't want to raise that child with the constant reminder. Again, take it to term and adopt. This idea that it's like I said, vegan Dawn, it's like, oh yeah, congenital defects, they're going to suffer, they're going to have a horrible life. We may as well just kill or euthanize, assisted killing, put an IV, just inject those medications, they go off to sleep, because these people have, though they're born, that they will suffer. Therefore, this is moral and compassionate, that we should kill these people.
And devastating thing.
Well, I suspect it can be both in either case. I mean, I think not only of the experience of my wife, but of many of my friends who have had kids. And they want kids, and they intentionally get pregnant, or at least they are happy when they find out that they accidentally become pregnant. But there's still a lot of trauma involved in that. I mean, there's a lot of suffering that comes along with that. That's part of pregnancy and childbirth and life generally. Life involves some degree of suffering. So it just seems what you're saying is when the pregnancy is desired, that is beautiful, and we should celebrate it. And when the pregnancy is not desired, then you ought to be able to end it, and meaning end the little baby. And it reminds me of you see this with the royal family. The royal family, the princess gets pregnant, and they say, we have the royal baby. The baby's only 10 weeks in gestation, but they say, this is a royal baby. But then some left-wing woman goes on television and says, I just had an abortion. Well, that's never a baby. That's just a clump of cells. But we're talking about the exact same thing, right? We're talking about a child at, 15 weeks gestation, 20 weeks gestation, let's say. So yes, I understand that the experience of sex and pregnancy can be felt differently in different circumstances, but the baby himself would be the same in both circumstances. It's just in one, we celebrate his beautiful baby life, and in the other, we kill him as a clump of cells.
So when it comes to medical terminology, it's actually an embryo or a fetus. And when you call it a clump of cells, I agree that can feel dehumanizing. But on the same side, when you call it a baby, that's also anthropomorphizing. So I think right. And so
we're humanizing a fetus. I don't care if it's embryo, fetus, baby, it's human. If you look at the definition of a fetus, it is an offspring of a human or other mammal in the stages of prenatal development that follow the embryonic stage. Just looking to see. Yeah. Pretty much, yeah, all the definitions sound very similar to that.
So that's neither side is correct in its entirety, and that doesn't remove what.
Well, I guess you're entirely right that I mean, you mentioned the word fetus, which ironically is dehumanizing, although the word fetus, the Latin word fetus just means offspring, and we're referring to human beings here. But doesn't the question hinge on which language should we use? So one is dehumanizing, one is anthropomorphizing, in other words, humanizing. So then isn't the question that we have to answer?
Yeah, because especially on Young America Foundation, I think it's a conservative organization, and they do talks, and a lot of people come up on the debate between. A lot of people talk about abortion, and they will use words like fetus or clump of cells. It's true, and you'll see that this is a way again of dehumanizing the human that is growing inside the belly. The
Answer. Is this thing that we're talking about a human or not? And if it is a human, then we should only use the anthropomorphizing language. And if it is not a human, then we should only call them a clump of cells.
Yeah.
Well, when it comes to medicine and medical practice, it is you call it a fetus, and the reason.
But I don't call it a fetus.
Well, but you're also not a medical professional, are you?
But I'm a human being with rational faculties,
Right, but
who describes the world around him, right?
True, but
Just
you aren't
as
having discussions with pregnant people, and
I
when
often am.
pregnant people. Another way of saying that is a woman, because you need a uterus, and men don't have uteruses. Only women have uteruses, so only women get pregnant.
as a medical professional. So there are articles written for medical professionals about how to have these conversations, and it is appropriate.
We currently have a medical institution. Laws are being passed, but it kind of went under the radar. They're doing certain procedures based on certain ideologies that are prevalent within our society. This ideology has hit the medical community, where the medical community is now giving medications to a certain younger age demographic that can have serious side effects, such as creating micropenises, as well as swelling in the brain, severe enough for some younger demographics to go blind. We're seeing with this recent medical practice by the experts, by the professionals that have thought deeply about ethics, ethics and morality and things like that. So this procedure is being done, and now they're starting to put laws to ban that, because this medication that is being given based on an ideology given to a younger demographic not only causes sterility, blindness, swelling of the brain, also osteoporosis. There's also, again, attached to this ideology that is prevalent in the culture, that is especially I'm focused more on the young age demographics. These people are getting certain surgical procedures that remove certain healthy tissue, which is a huge, huge leap, completely, in my opinion, against the Hippocratic Oath. So, anyways, so again, you're talking to Michael Knowles here, as if like, you know what, this met all of the experts, all of them agree on. Well, you know what, that's not true. And even on the question of abortion, there are as well physicians that are against abortion, that don't practice abortions, that conscientious, they're conscientious observers.
Appropriate to call it a fetus. And when the pregnancy is wanted, it is also appropriate to call it a baby when that pregnancy is wanted and desired, and you are trying to create a comforting and accepting environment for that pregnant person. But from a medical standpoint, it is
Pregnant person is a woman.
completely appropriate to call it a fetus until you understand where your patient is at.
I have a profound amount of respect for women, and I am not going to take away pregnancy from women. Okay? I'm not going to do that. Women exist. I want women to be acknowledged, and I am not, in the name of inclusion, going to take away the identity of women. It's getting to the point where, because we're using this people and those people all in the name of inclusion, the actual word woman is almost no longer used, and that's not correct. That's not right, in my opinion. And I don't care what you do if you're an adult. Right now, I'm objecting very strongly to children being affected by a certain ideology.
In their mentality regarding their pregnancy.
Is that guidance that doctors get? If the mother wants to be pregnant, then you can call it a baby. But if the mother doesn't want to be pregnant, you don't call it a baby.
It depends.
That's amazing that's the.
Yeah, G Legend, very good point. G Legend says, "Is she drunk, out of her mind? How do you humanize a human in the womb?" Yeah, exactly. By her saying that we are anthropomorphizing, we are humanizing a human fetus that is developing from an embryo to a fetus. Call it what you want, fetus. I don't care. Okay, it's a human, individual human that is in a process of evolving. Thanks. G Slayer says, great stream. Thanks a lot. Appreciate
medical guidance.
Yeah, well, it's all about creating a comfortable and appropriate environment for the patient because we care about the mentality of the patient.
So if it's a pregnancy that is wanted, you say baby. If it's a pregnancy that is not wanted, you say fetus or clump of cells. Okay. So what happens is she's going to object to us saying baby. She's going to say that's a way of manipulating people, guilting people by affirming that it's a baby and using that word. And I'll say the opposite, that actually you know it's a baby because that's what we call little humans, and you don't want to use baby because you want people to be comfortable. By calling it a fetus, it dehumanizes a little more. It's not a baby, it's a fetus. It's an embryo or a fetus and stuff like that. So by saying that, the mother does not feel guilty because you're not using baby. So if you would present the facts and the reality that it is the murder of a human child, perhaps people would follow their conscience and they would repent and they would ask for forgiveness and they would change their ways. There are many Christians that pray in front of abortion clinics or give information or pamphlets or speak to them a little bit. And these people are being arrested. There was one person that was doing that, and I guess he wasn't even directly in front of the Planned Parenthood. Planned Parenthood, by the way, is something that in the States that it's an abortion clinic. It also gives hormones out. So it is not support for pregnancies. There's another organization, or there's other facilities that open up that are for pregnancies, emergency pregnancies and stuff like that.
And you want the patient to be able to make an informed choice. You want the patient to feel comfortable in your exam room. And calling it a fetus when it is a wanted pregnancy can make them feel detached from that pregnancy, but also calling it a baby when it is an unwanted pregnancy can put, unnecessary pressure and fear onto that pregnant person.
But you don't believe that whether or not the baby is human hinges on whether or not the mother desires the baby or fetus.
It's the question.
You don't think that the desire is the determining factor for the ontology of the embryo.
The embryo is human. That's not within question. It is a human embryo.
So then why wouldn't you use anthropomorphizing language? Why wouldn't you refer to it in human language?
Because language is often emotional, and pregnancy is an emotional state for someone to be in. And as a medical professional, you have to be conscious of the way that your words affect the patient.
And so you would lie to the patient? Because you've
It's
just
not
said,
lying.
well, you said it is lying, because you said the baby or fetus or whatever you want to say is a human, and you said the word baby is humanizing language. So you're describing the human being with humanizing language, unless you say that the emotions of the pregnant mother are such that you don't want to describe the human being in humanizing language, and so you describe the human being in dehumanizing language. How do you, and you're doing it knowingly, you've just admitted the baby's human.
Yeah.
How would you describe that other than telling a lie?
I didn't say that anthropomorphizing was necessarily a negative thing. And as I said, saying fetus is medical terminology, and it is appropriate. It is appropriate
But it's
description.
dehumanizing, you said.
No. Calling a clump of cells is dehumanizing.
Oh, okay.
Calling it a fetus is not dehumanizing. It's medically appropriate, and it's medically consistent with how you should, define.
Then why the distinction? Why?
I'm completely fine with using fetus. I agree that it is a medical term. It is accurate. It also just means, just a minute, sorry. Sorry, I'm like completely blabbing loud, and I was just about to pass the baby's room. Please, oh no, she's waking up. Oh, damn it! My bad.
Are you given the guidance to call it a fetus to the woman who doesn't want the baby, and a baby to the woman who does want the baby?
I've explained this to you, but I can explain it
Or
again.
maybe I'm just a little slow.
That's okay. I'll slow it down for you then.
So arrogant, the lady. I like how she's like sitting there as if like she's a medical professional, when it's like, actually, you're just a student. You're learning. If you're a med student, you basically have never really hardly been at all in a hospital. You're not even a resident yet.
Depends on the mentality of the pregnant person and how they feel towards that pregnancy. Because as a medical professional in that exam room, you are trying to create a comfortable environment where that patient understands what their options are and what their situation.
Make them comfortable or not. If we're looking at the fact that we are terminating sometimes well beyond 15 weeks, these late-term abortions that do exist, we have to realize that we are terminating the life of a human offspring. That is accurate. Okay? It's not a medical procedure, it's murder. Okay? It goes against the Hippocratic oath of do no harm. Just because we want to decide that the doctor is a is there for the mother and not the child, that's just an immoral decision that would never occur in a theistic worldview.
Situation is. And so when you are trying to identify how they feel about their current medical state, you want to use language that creates a comfortable environment for them.
So how do those two words affect their emotional statement? What is the reason for the distinction? When a pregnant mother who doesn't want the baby hears you describe the baby as a fetus versus as a baby, how are they perceiving and conceiving of that?
So I can probably ask you the same question, Michael. Why on your show and in these interviews do you insist on calling it a baby? Is it because you understand the emotional pull that has on your viewers?
No,
So you
Yes, 100%. I would use the word baby so that the person understands and hopefully would change their mind or come to repentance. If you're making it sound like it's a clump of cells, you're not using the word baby and all those things, so that the mother doesn't feel guilty or anything like that. You're trying to dehumanize, like you said. This lady literally said anthropomorphizing, meaning humanizing a developing human. Like you don't have to anthropomorphize because it is actually a human offspring. So you're actually, doing the opposite, dehumanizing.
insist on using that language
it's
because
for
you
the-
understand it's emotional.
No, it's because I think it's ontologically precise in exactly the way you just described, because you say that the word baby is anthropomorphizing, and you said that the human being inside you is a human being. And so it's appropriate to use humanizing language for human beings.
Depending on the conversation that you are having, because you have to be aware and compassionate towards the person that you are having that discussion.
Right, but I don't think it's compassionate to deceive people or to pretend that the human isn't a human. I think that it's always disrespectful to lie to people.
Calling it a fetus isn't lying. Calling it a fetus is medical terminology.
But it's less anthropomorphizing than baby, you would admit.
It's medically appropriate.
But would you admit that it's less humanizing than the word baby?
Less humanizing?
Yes.
No,
Or
because it's a
anthropomorphizing.
human fetus. It's a human fetus.
It is. So
Yes.
so if the two words are synonymous, why is there guidance for one and then the other? What you keep saying it's because of the emotional state of the mother.
Yeah.
But okay, how is that perceived? How do the emotions change hearing one word or the other?
Again, I think you understand this because you choose to say baby. Why do you choose to say baby instead of fetus?
Because it's I just
Because there's an emotional.
no, because
Vegan Dawn says, you are degrading women to tools that'll never end well, but it is a fascinating issue. Very interesting debate you comment on, and I just wanted to make some counterpoints. Okay, that's cool, man. Thanks, Vegan Dawn. No, I'm not degrading women to tools by acknowledging the unique capability of women to be able to grow new life. So no, that's why I do not like the idea of calling them birthing people, because it takes away from the unique power, the special abilities that a woman possesses. I don't like that right now. By using people for everything, you're basically eliminating the word woman. And the vocabulary is a way of manipulating thoughts in the long run, preventing certain words or using different, subtle differences. So thanks again. Okay, we're not talking about veganism, so I'm glad, Vegan Dawn, that you find it interesting, the debate. And that you're just trying to do some counterpoints. I also appreciate that, but I really don't think that me saying that woman is a reality. Women are able to get pregnant. They're able to grow a human being. That's insane. That's just, wow, so impressive. And I don't want to take that away from women, because it is women that have that capacity.
Because it's
There's
precise
emotional
and true.
baggage. Because there's an emotional baggage that comes with baby. And so if it
No,
is,
because it's plain language. And so I generally try not to use sort of Latin or jargony terms for things that are plainly understood. And so that's why I prefer good Saxon words and good plain words. And I don't use a 25-cent word when I can use a nickel word. And as you just said, the guidance to use one word or the other based on whether the mother wants to have an abortion or wants to give birth to her child, clearly, though you don't seem willing to admit it, but clearly is because the word fetus allows this pregnant mother in distress to abstract away the humanity of her child and makes it easier for that woman to justify having an abortion. Whereas if she were to call it a baby, it would be much, much harder for her to justify killing the baby in the womb through abortion, right? I think you would acknowledge that.
yeah, I can acknowledge that calling it a baby minimizes the options that the pregnant person feels like they have, and it can
Right.
put unwanted pressure onto them.
I'm just going to fast forward this whole fetus definition and stuff like that to the next point. So I'm going a little faster through this.
And if they are not in a financial, mental, or physical state to carry through with that pregnancy appropriately, calling it a baby makes them feel as if they have less options than they truly do and should have.
So you mentioned.
Yeah, no, how about this? How about calling it fetus if you want, whatever, but acknowledging that a fetus is a human offspring of the parents, and that it's human, that the end product is a baby, and that by acknowledging that, hopefully it would increase the chance of the parent bringing the baby to term and then adopting as a choice. I just really feel that if you are having sex, that you should assume the consequences, and because you're an adult and your actions, you should be held accountable. I know that sex just seems like just free sex, boom, there's nothing, it's like there's nothing wrong with it, have sex with whoever you want, as many times as you want. I'm not being a hypocrite about it, but I'll tell you one thing: if I would have gotten somebody pregnant, and she didn't want to kill it, because I know as a man I have nothing to say about whether my offspring would be killed or not. What do you think about that kind of thing? But anyways, let's get back.
In those three states that you might be in where you don't want to, where you want to kill your child: a financial state, psychological state, and what was the other one? Physical state.
Mm-hmm.
Yeah, like Vegan Don, don't you think that degrading women would be not using the word anymore? Women, they breastfeed babies, and they've changed it to chest feeding. I don't understand. I really don't understand exactly why they've changed it to chest feeding, because men and women have breasts. So it seems like because all of this comes from just social media influences and stuff like that. Oh boy, we're at an hour 40 minutes. Let's do another. Here, let's invite, if anybody wants to come on, feel free to come on. Vegan Don, if you want to come on. Margaret, any of you guys, everybody, let's all jump on if you want. There's four people, so I don't know if it includes me. Press the StreamYard link if you like. Just continue presenting. When I'm actually playing something, I cannot see anyone joining. So, oh, there's Margaret. Just a minute. Hey, Margaret.
Hi,
How are you?
I'm disgusted with all this. I
Yeah.
I was just reading up and Sinem, I put it in the chat. Company in Switzerland is using the aborted fetus cells.
Yeah.
They're selling to Nestle, Ajinomoto, and what's the other one? Firmatech.
Yeah, I just popped it up on the screen.
Yeah, and that's used as flavor enhancers. So now we are cannibals.
That's disgusting.
And a cosmetic company that I wrote in the chat too are using it for anti-wrinkle.
Well, that's worth
your
it
cos-
because wrinkles suck. I'd be willing to do that. No.
Yeah, but in the cosmetics. So basically,
Yeah, it's
we're
crazy.
cannibals if we use these products.
Yeah, no, that's really weird. Do you have? Are you able to pop up where you read this or?
Um,
I'll try and look for it too.
It's Rehumanize International.
Just give me a sec. I wrote Rehumanized International.
Rehumanize, one word.
Yeah. International.
International.org.
Yeah. Okay. I see it. Human rights for all human beings. All right.
So this Planned Parenthood
Yeah.
on a big company like these guys, and I go in and I say, I want this, I want that.
Yeah.
And I hand over the money and I get my products to make other products. That's disgusting.
Yeah, I know.
This was a life.
Yeah. I just put it up. I think you can see this. So, but where does it say the the fetal cells and stuff like that being in
Fetal
stuff?
cells in the cosmetics, food, and
There,
medical.
I'll try that. I have too much stuff popped up. So fetal cells. Which screen do you see now? Do you see like right now like you fetal cells in cosmetics, or do you see the other screen?
But geez.
Because they changed the interface. Do you see just a minute? Do you see something green on the right side of the screen?
Hang on, I'm going to show
Yeah.
you. Can you see it?
Just a minute.
Can you see it? Does it show?
Yeah. Okay. Wait. Let me put it bigger. Oh crap! Just give me a sec. Okay.
You got it?
Yeah. Okay.
You
So
even
that
want to
means,
see an old lady.
that means every time I have to get out and stop sharing and reshare. So okay. Rehumanizing cells international. Yeah, fetal cells in. Okay, so let me stop screen share. Present screen audio. So, oh gosh. Good.
That's it.
So you see it okay now? Fetal cells in cosmetic, food, and medical industries?
Yes,
Yeah.
perfect. When I was told about this Planned Parenthood, I thought it was, oh, you go there and they give you nutritional menus and
Yeah, no.
where to get diapers and stuff like that. I was so ignorant. I did not know that was happening.
Yeah, it's basically just an abortion factory, and obviously they jumped on the hormone blocker administration too. There are like crisis centers for pregnancies and stuff. They're all tons of them have been bombed, burned down. Zero people found and brought to justice for that. Meanwhile, people that are in front of birthing centers, Planned Parenthood, or they're not even in front anymore. I don't think you're allowed to be directly,
No,
but they're
you're not
in the
allowed in front.
proximity, you know. And
Because one of our friends, he goes, when he has a day off from work, he'll go and stand on the opposite corner with
Exactly.
pamphlets to people that will be going into these places.
uh-huh. Yeah.
Yeah, there's one
And
downtown.
now they're getting harassed and
Yes, he's across
what-
the street because you're not allowed in front
Yeah.
of the building. He was across the street and they called the cops on him and two of his friends.
they
And
had a SWAT team. One person, he has 6 kids or something. He's a Christian. Yeah, sure. Can you get cream? Yeah.
I
Um,
think that's really disgusting.
it's probably here.
So when you go into these places, you have to sign a whole bunch of documents releasing
Yeah.
your aborted baby for whatever.
I don't have
You've cut all ties. Your aborted baby now belongs to them.
check my coat.
I will.
Just give me a second, Margaret.
Yeah.
I lost my guichet. I just want to check in my clothes. Oh, that's wonderful. No more lost my debit. Yeah, I'm trying to go through there. I lost my debit card, so no, it's the search for the debit card. Is in my. What did I last purchase? I purchased a coffee.
And razor cream.
I purchased a coffee. I know. So, anyways, I'll end this shortly because I'd like to.
Well, I'm gonna go and look. I'm gonna go
Find
try to
it.
find it. No, that's
Yeah.
fine.
Well, no, it's not relaxed. I don't like it.
I understand that. But I'm gonna look for
Like,
it right now.
You can literally tap like the
Yeah,
card
I
without it.
get that, but you're not gonna do anything faster than I am, so I'm gonna go and look for it.
Okay. I'm gonna end this and look for it too. Alright. I hate losing my Interact card. Okay, let's try and get to here. So it says the fetal cells have been used for research since the 30s. In order to obtain these cells, an aborted fetus is collected after their death, usually by a technology company, university, or medical center. A tissue donation is removed and the sample is brought to the lab. Okay, they do all sorts of stuff. Lung tissue of a 3-month-old fetus aborted in 1962. 14-week-old cell line known as this. These cells, I want to see.
I just have one thing to say. That was then in the 30s, 40s, and I believe the 70s.
Uh-huh.
So why is Planned Parenthood still selling baby bits?
Yeah. Oh, I don't know. Yeah. Originally, it was used. Researchers discovered that the cell line derived from the skin of 14-week-old male fetus aborted in Switzerland had restorative properties for the skin. Originally, it was used to treat ulcers, burns, and scars. Eventually, the skincare brand Neocutis realized that the same properties that healed injured skin could be used to rejuvenate wrinkled skin. Yeah. So, anyways, here's Nestle, like she had mentioned.
And that company doesn't hide it. They say, yes, we do.
Thanks,
Yeah.
Michelle. Say that again.
And that company, they don't deny. They say, yeah, we do.
Yeah. Oh, it's because it's legal, probably. So, what do they care? Yeah. All right. So we'll get that down. Vegan Don says that is disgusting. I thought they used animal babies in the industry, which I, of course, also find terrible. Who wants to put on any baby cells? Yikes. Yeah. Well, we can agree on that, man. Present.
And it goes on. They also have a little list there of companies that broke ties with Simomex, whatever it's called.
Yeah. The broke ties with them?
Yes. Kraft Foods was one. Where is it? Where did I see that? Campbell Soup. Where did I see that?
So what? These were companies that were part
Yeah,
of this.
when they found out what the flavors were, they no, we don't want that in our food. No, no, no,
Flavors.
no. Yeah,
I should have
because
read more. What exactly why would it
they use the kidneys as flavor enhancers or something. Scroll down. It says in the green, flavor receptors in the kidney cells.
just give me a second.
Taste testers. Something
Well,
like that.
you have it, right? Because I went I
So
I brought
Kraft
it.
Foods.
I X'd it, so I don't have it. Go.
Okay, Kraft Foods, Soleil, Campbell's Soup, Pepsi. They have changed and canceled their contracts with Sinomax to ensure that no fetal cells were used to develop their products.
Hmm. What about in the article? It talks about the taste and stuff. You said.
Oh, yes. In the food and beverage industry, biotech company Sinomax uses the cell line HEK-293 for research and development of new flavor additives. To be clear, they are not adding fetal cells into the food or beverages. Rather, they use the flavor receptors in the kidneys of the aborted female fetus as taste testers. I don't know how you do that, but anyway.
I don't
This
know.
allows Sinomax to efficiently test new formulations of flavor scent additives to produce the most flavor with the least amount of sugar and salt.
All right. That's so gross.
Companies that have developed products with Sinomax include Ajinomoto, Nestle, and Firmenich. And then the other companies broke all ties with them and all contracts.
Well, thanks for bringing this to our attention. Very odd, weird, gross.
It is gross. It's cannibalistic.
Yeah, for sure. All right, I think I'm gonna stop it here. We're almost at 2 hours, and we made it to 22 minutes of the debate. And what we can do is try and do a couple more, maybe smaller ones. Like I'll try and get it to an hour and a half or an hour, and we can comment, and we can also have you guys up on the panel if you want, and we can stop it, and give our opinions. Might be more interesting responding with multiple people. So I still haven't figured out or taken the time to make a consistent time to do my live streams, like this day, this hour. So people,
real life first.
yeah, because like these, just boom, spurred the moment at any time, probably would get a lot more people if people knew ahead of time. Oh, it's always at this time, But all right, I'm gonna let you go. I'm gonna
Nice
go.
chatting.
My granddaughter should be waking up soon, so
Yeah, nice chatting with you.
yes, thank you as always, Margaret. All right, guys.
I
Have a
left
good
you a message if you could pass it on to Bruce, because I don't know how to contact him, because
Yeah.
his emails are like unbelievably long. Takes
Yeah,
him a year to go through them.
yeah.
Okay, thank you.
No problem. Sorry, what did you want me to tell Bruce?
Yeah, I left you a message.
Okay.
Yeah,
Okay, understood. All right.
thank you.
No problem. See ya.
Take care. Okay.
All right, guys. Have a good one. Please write your opinions in the comments, what you think about abortion, or what you think about what I've said, or whatever you'd like. Please comment, as well as the next live stream, where we'll probably be continuing Michael Knowles' debate against a pro-choice activist. So again, you guys are welcome at a certain point with the next live stream. I'll send the link, send an invite, and you're completely welcome to come on, and we can do this live and discuss. All right. Thanks a lot, guys. Bye-bye.